So the CART19-BE-02 trial was a multicenter trial, was a phase II conducted across 9 Spanish centers, and that included patients with relapsed refractory BLL. So one of the most important aspects of the study is how we did define success. This was not just, morphological remission, but our primary endpoint was complete response with undetected MRD at 10 times to the -5 at day 28. So we deliberately chose a stringent MRD-based endpoint, basically to align with contemporary clinical decision-making and not just traditional morphological response, so which is used in most the other trials. So and the other key distinctive feature was that we were using a fractionated adaptive intrapatient dosing strategy, which instead of giving a full dose of one go of CAR T cells, we administer and escalate in fractions over several days. So with safety checks before each infusion. So with this approach, we basically reflect something very practical, which patients are biologically heterogeneous. And, disease burden differs, expansion kinetic differs. So we designed a strategy to allow to basically listen to the biology of patients in real time. And by doing this is basically CAR T cell approach that adapts to patients and not the other way around. Finally, the primary endpoint was met. About more than 80% of patients were able to achieve an MRD-negative complete remission at day +28. So this was even higher within the first 3 months, which was up to 95% of patients in the patients that were able to receive the maximum var-cel dose. So very importantly, this also translated into the durability of response. Those patients that received any amount of var-cel doses had a median duration of response that was around a year. And among those patients that were able to receive the full or the maximum dose, we have a median duration of response of around 16 months.